Hi, good afternoon. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from Needus Academy. So another weekend is here and I'm with another new topic from part B as well as a new topic about part A. Okay, so as usual, I'll give you 2 minutes for the preparation of this question and here comes the question. Yes, so welcome back. How was this question? എങ്ങനെ ഉണ്ടായിരുന്നു? A very different type of question from part B. So the question is like, the main message of the text is that. Okay, a different variety of question, right? So my keywords from the question, main, message, and text. Okay, say yes. Shilpa, Midun, Taku, Jilba, Divi, good afternoon, guys. Okay, so coming back to this question, so what category of question is this? A very different kind of question. So, in the type of question. Okay, any idea what category of question or what type of question? The type of question, which is, yeah, of course, multiple choice questions with 3 answer options. But my question is, what category of question is this? It in the category of question. Okay, the main message from the text. Okay, so what do you mean by the message from the text? So usually we can see messages from the last lines. Okay, for example, when I tell a story or when we tell a story, the message will be in the final lines. Okay, so what is the message here? I'll read the paragraph, then we will discuss the answer, okay? So the message from the text is that, option A, physical activity is risky and should be undertaken with caution. So my keywords, physical activity, risky. Okay, so these are my keywords. Option B, option B, children should be discouraged from sports that can cause injury. So my keywords, children should discouraged. Option C, people should not avoid physical activity due to perceived risk. So my keywords, should not, then avoid. Yeah, so these are my keywords. Okay. Hi Kavita, Monisha, Aisha, Amrita, Nijida, good afternoon. Okay. Yes, Amrita, this is from category 3. Very good, Amrita. Yes. So the main message of the text, which means the overall idea, especially from the last line. So as you know, guys, in the third category, if it is an email, a memo, or a guideline, or a notice, we are reading for the purpose, to know the main idea, I mean, the overall idea. Not the main idea, the overall idea. And which lines are important there? Last lines are important. Okay. So, just like that, in this question, they are asking you regarding what is the main message from the text. So, here, message, which will be in the last lines, final lines. So, this is like a third category, maybe an email, or a memo, or notice. So we can make sure that this is not an email, not a memo, because there is no sender, no receiver. So maybe this is a notice, okay, which comes under the third category, notice. And what are you reading for in a notice? We are reading for the purpose. Okay, yes. Very good, Jisa. Last lines are important. Yes, Amrita, this is a notice. Hi, Jisa. Good afternoon, dear. Okay, so I'm going to read the paragraph, then we will do elimination method. Health risk of physical activity. Concerns about safety may be a barrier to participation in some sports, particularly among children. A survey of parents in NSW identified that more than 1/4 parents of active children aged 5 to 12 years reported discouraging or preventing children from playing a particular sport because of injury and safety concerns. So, majority എന്ത് ചെയ്യുന്നുണ്ട്? The parents were discouraging, or the parents are discouraging children from playing because of injury and safety concerns. Okay. While some sports are offered to children in a modified format, which increases safety, other sport and leisure time activities could also be modified to increase patient safety. So, we are doing a lot of things to make patient safety. Okay, അല്ലെങ്കിൽ participant safety make sure ചെയ്യാൻ വേണ്ടിയിട്ട് we have a lot of approaches here. അല്ലേ? And what about the second para? For adults, there are some forms of physical activity that have increased rates of injury. In some instances, safety equipment may be used to reduce risk of injury. There are also risks associated with participation in too much exercise, particularly among those who have previously been sedentary. Sedentary, which means lazy, inactivity. Okay. However, the benefits largely outweigh the risk. See the last line? However, even though we have a lot of injuries or risk factors associated, with the help of physical activity, we have a lot of what? Benefits than risk. And effort should be made to encourage participation. എന്താ ചെയ്യേണ്ടത്? ഡിസ്കറേജ് ചെയ്യണോ or encourage? We should encourage them to participate because more than the risk factors we have benefits. Okay, so what is the correct answer here? Let's do elimination method, and that is the strategy we are using in part B and part C. So what is elimination method? So could you please eliminate the options? ഏതൊക്കെ ഓപ്ഷൻസ് നമുക്ക് എലിമിനേറ്റ് ചെയ്യാം? And what is your answer? Let me know in the comment box. Okay, Jissa, last lines are important. Yes, Amrita, this is a notice and purpose is important. Very good, Amrita. Yes, Jissa, we are reading for the purpose. Okay, Aisha, last line is important. Very good, dear. So, which is the correct answer? Yes, Taku. Okay, only one person got the correct answer? Okay, Taku and Monisha. Anyone else with the correct answer? Yeah. Shilpa, Aisha. Okay, very good. So, answer is option C. Okay, people should not avoid physical activity due to perceived risk. Risk ഉണ്ടെന്ന് വിചാരിച്ചിട്ട് physical activity avoid ചെയ്യരുത്. Okay, why? And actually answer is in the last line. This is the answer. Okay, answer is option C. Okay, so my next question, how you guys eliminated option A as well as option B? നിങ്ങൾ എങ്ങനെ option A and B eliminate ചെയ്തു? Yeah, a lot of correct answers. Okay, Taku, Monisha, Shilpa, Aisha, Kavita, Steffi, Adira, Jissa, Amrita and Amy. Very good, correct answer, which is option C. So now, please let me know how you guys eliminated option A as well as option B. ബാക്കി രണ്ട് ഓപ്ഷൻസ് നമ്മൾ എങ്ങനെ എന്തുകൊണ്ട് എലിമിനേറ്റ് ചെയ്തു? നമുക്ക് എലിമിനേറ്റ് ചെയ്യാം, ദാറ്റ് ഷോ. യാ, വി ക്യാൻ എലിമിനേറ്റ് ഓപ്ഷൻ എ ആസ് വെൽ ആസ് ഓപ്ഷൻ ബി. വൈ? വാട്ട് ഈസ് ദ റീസൺ? യെസ്. Yes, Amy, why we have eliminated option A and B? Yes, Amrita, Jissa, Adira, Steffi. Yes, Steffi, why? Why we eliminated option A as well as option B? എന്തുകൊണ്ട് eliminate ചെയ്തു? Okay, Shilpa. Option A should be undertaken എന്ന് പറയുന്നില്ല. Yes. Option B discouraged അല്ല. Very good. Yes. Okay, so option A, physical activity is risky and should be undertaken with caution. It is not mentioned. Okay, simply we can eliminate option B because it is not mentioned. Okay, where is it mentioned? Should be undertaken with caution. It is risky, I agree, it is mentioned somewhere in the para, but nothing mentioned about should be undertaken with caution. So not mentioned. What about option B? Children should be discouraged. Discourage enamnano parayne? No, encourage. We should encourage them. So that is contradictory option or opposite option. Clear? So answer is option C. People should not avoid physical activity due to perceived risk. Okay. Yes. Okay, Aisha. Eliminate option A and B. A not mentioned. B contradictory. Very good. Good understanding. Okay, Kavita. Option B is contradictory or opposite option. Very good, dear. Yes, Jissa. Yeah, B is contradictory because in the paragraph it is mentioned to encourage them. Alle? Okay. Yes, Steffi. Very good. Option A not mentioned. Option B contradictory or opposite option. Yes. So this is how we are understanding part B. ഇങ്ങനെയാണ് നമ്മൾ മനസ്സിലാക്കുന്നത്. Okay. So along with reading, we should eliminate your options. Okay, നിങ്ങൾ വായിച്ചുകൊണ്ട് തന്നെ നിങ്ങളുടെ ഓപ്ഷൻസ് എലിമിനേറ്റ് ചെയ്യണം. Okay. So that's all about part B. So now let's move to the new topic from part A, which is ARDS. Okay, acute respiratory distress syndrome, which is ARDS. Okay. So today I'm going to read the complete text by text. Then I will underline certain keywords from the text. Then I'll read the question, do the same. Then let's find out the answer. Okay. Yeah. So I hope you have done the material, right? Ellaru material cheyido? Okay. So I'm planning to make some difficult topics from next week. Okay, from Monday onwards, let's do some difficult materials. Yeah, like we can do some materials regarding your exam pattern materials. Okay, because we have exam next week. Okay, next Saturday we have exam. നമുക്ക് exam ഉണ്ട്. അപ്പോൾ അതുകൊണ്ട് next week നമുക്ക് let's do discuss about part B in detail as well as let's do some difficult materials next week. Okay. Yes. Okay. Exam date എടുത്തിട്ടുണ്ടോ ആരെങ്കിലും? All right. So I'm going to read this. So please do let me know in the comment box what are your keywords from text A, text B, text C and text D. Okay, don't be sedentary, don't be lazy. Please do comment. എന്തൊക്കെയാണ് നിങ്ങളുടെ keywords ഒന്ന് comment ചെയ്യുക കേട്ടോ. Okay, I'm not asking you to completely, type all the keywords that you know, just important words. Okay, important ആയിട്ടുള്ള words. Okay, Aisha, yes ma'am, September 28. Okay, all the very best dear. Okay, നമുക്ക് നോക്കാം. So, from text A, acute respiratory distress syndrome, that is ARDS, is a lung injury that happens when fluid build up in small air sacs, alveoli, in your lungs. ARDS prevents your lungs from filling up with air and causes dangerously low oxygen levels in your blood, hypoxia. ARDS prevents other organs such as your brain, heart, kidneys and stomach from getting oxygen they need to function. ARDS is dangerous and can lead to several serious and life-threatening problems. ARDS typically happens when a person is in hospital receiving treatment for infection, illness or trauma. If you are not hospitalized and experience symptoms of ARDS, get medical attention immediately. Healthcare providers sometimes classify ARDS into 3 stages: exudative, proliferative and fibrotic. This classification mainly describes the level of inflammation and fluid buildup and the subsequent repair process that your lungs go through to heal. Not all people progress to the 3rd stage, which mainly describe the formation of scar tissue in your lungs and prolonged need for ventilation. So these are my keywords from 1st and 2nd para. So 3rd para, ARDS affect 2 lakh people in the United States and 3 million people worldwide every year. ARDS causes around 10% of all intensive care unit or ICU admissions. It is the reason at least 25% people require mechanical ventilation in the hospital setting. So these are my keywords from text A. Okay, so what about you guys? On the comment cheyamo. Okay, ee keywords underline cheyada pattilla. These are very important. So what are the keywords? Yes. Hi Delighta, good afternoon. Yes dear, I'm doing great, thank you. So what about you? Okay, Aisha, welcome, most welcome dear. Yes, Monisha, ARDS, alveoli, hypoxia, life-threatening, 3 stages, fluid buildup, scar tissue, ventilation, excellent, very good. These are the important keywords from text A. Very good, Monisha. Yes, good effort. Okay, so text B, causes of ARDS include. So what are the causes here? Sepsis is the most common cause of ARDS. It can happen when you have a serious infection in your lungs or pneumonia or other organs with widespread inflammation. Aspiration pneumonia or aspiration of stomach contents into your lungs may cause severe lung damage and ARDS. Aspiration is when food or liquid or other substances get into your airway and lungs. Then blood transfusions. You are at risk for ARDS if you receive more than 15 units of blood in a short period of time. Then the COVID-19 virus may develop into severe ARDS. Pancreatitis, severe inflammation in your pancreas. Major trauma or burns, accidents and falls may directly damage your lungs or other organs in your body and trigger severe inflammation in your lungs. Then inhalational injury, breathing and exposure to high concentrations of chemical fumes or smoke. Then drug overdose, an overdose on drugs like cocaine and opioids. Then drowning or near drowning. Drowning causes water to get into your lungs, causing damage. Okay, so these are the keywords from text B, and we have a small subtitle here. Some factors that can increase your risk include. So what are they? Being older than 65, tobacco use, substance abuse disorder, having lung disease. So these are the keywords from text B. Okay. Yes, Monisha. Okay. Yeah, I start with. Yeah, Delighta, ARDS, alveoli, hypoxia, brain, heart, serious infection, trauma, exudative. Very good. Proliferative, fibrotic classification. And Jissa, ARDS, hypoxia, life-threatening trauma, healthcare providers, 3 stages. Okay dear, very good. And Monisha from text B, ICU 25%, not from text B, right? Text A. Yeah, text A. 25%, 3 million, mechanical ventilation. Okay, Jissa. Text B il endokayana? Yeah, causes, sepsis, pneumonia, aspiration, blood transfusion, 15 units, COVID-19. Pancreatitis, risk factors. Very good dear. Excellent. Okay, so text C. Diagnostic criteria. Then Berlin definition of ARDS. Respiratory symptoms must have begun within 1 week of clinical insult or new or worsening symptoms during past week. Then bilateral edema consistent with pulmonary edema or CXR or CT. Then PTS, respiratory failure, that is a short form, must not fully explained by CCF or volume overload. A moderate to severe impairment of oxygenation must be present as defined by PaO2 or FiO2 ratio. Severity of hypoxia defines severity of ARDS. Then mild ARDS, PaO2 or FiO2 greater than 200 but less than 300 on vent settings with PEEF greater than 5 cm H2O. Then moderate, again short form on moderate, PaO2, FiO2 greater than 100, then less than 200, PEEF greater than 5 cm H2O. A lot of signs and symbols mentioned, abbreviations mentioned, numbers mentioned. Okay, very carefully you have to read it. Then if it is a severe case, PaO2, FiO2 then less than 100, PEEF greater than 5 cm H2O. So these are my keywords from text C. Okay, diagnostic procedure aanu koduthirukkune. And what about text D? Again there is a table. Okay, so what is a table? Management of ARDS. How we can manage the condition? General measures mentioned here, ventilatory settings mentioned here, monitoring parameters mentioned here, then adjunctive measures mentioned here, ventilator settings again. Okay, so these are all about the management. Okay, so that's that. Yeah, so finally here a lot of full forms mentioned. ARDS and that, FiO2, what is FiO2, PaO2, what is that, PEEF and that. So a lot of definitions for abbreviations mentioned in text D. Okay, yes. So let's move to the questions. Okay, but before that let me know your keywords. Okay, Delighta, yes, causes sepsis, pneumonia, aspiration, COVID-19, pancreatitis, inflammation, inhalation, injury, overdose, drowning, tobacco, 65, abuse. Very good, dear. Okay. Then Monisha, sepsis, aspiration, pneumonia, 15 units. 15 units of blood, alle? Yeah. COVID-19, cocaine, opioids, very good. Pancreatitis. Okay, Amrita, option A is risky. They mentioned, not mentioned. Encourage, they say. Okay, dear. It's about part B, yeah. Okay, then Jisa, text C, diagnostic criteria, 1 week, bilateral edema, pulmonary edema, moderate, mild, then abbreviations. Okay, Monisha, Berlin definition, yeah, Berlin is important, name of a person, yeah. Respiratory, 1 week, again abbreviations, moderate, mild, severe. Okay, Delighta, Berlin, 1 week, bilateral edema, CXR, CT, CCF, PaO2, abbreviations, mild, moderate, severe, 100, PF, H2O, 5 cm. Very good, very good. Excellent, okay. So yes, so the first question. What measurements indicate the slightest form of ARDS? So my keywords, measurements, slightest, yeah, only 2 keywords I'm just marking. Okay, so what are the keywords here? What are your keywords? These are my keywords, measurements and slightest. Okay, what is your answer? Let me know in the comment box. And I know definitely you guys got the answer. So please let me know in the comment box what is your answer. Endana answer. Measurements indicate slightest form of ARDS. Yes. Slightest form, it is a synonym actually used here. Instead of slightest form, in the paragraph they have mentioned what? What is mentioned in the para? Let me know in the comment box. Slightest form in the pagaram, our paragraph il endha mention cheyidekkunne. What is mentioned in the paragraph? Yes, mild. Okay, mild. Yes, mild is mentioned in the para. So measurements indicate the mild form of ARDS. Very good. A lot of correct answers. Excellent, Monisha. It is mild. Yes, Jisa, measurement and mild. Very good, Jisa. Yes. So answer is from text C, and I know that you guys got the same. Yes. How many correct answers? Let me know in the comment box. Yes, Taku, Monisha, Jissa, Amy, Chinju, Star, Delighta, Atira, Shilpa. Yeah, Geeta. Yes, Aisha, it is from text C. Okay, and where is it mentioned in text C? There is a table here. And yes, mild ARDS. Kanda. Okay, so the slightest definition that the measures mentioned here in text C. So answer is text C. Yes, Divi, it is from text C. Very good, dear. Okay. Question number 2. The parameters that are used to manage ARDS. So my keywords, parameters, manage, yeah, only 2 keywords again. So what are the parameters? Yes, Aisha, slightest, which means mild. So what about the second question? Parameters that are used to manage ARDS. So what are, where they've mentioned about the parameters here, in which text? Yeah, I'll wait a few seconds, so please do comment your answer. What are the parameters they have mentioned? I mean, in which text they have mentioned about the parameters? Okay, very good. Okay, so answer is from text D. Okay, so where is it mentioned in text D? Management of acute respiratory distress syndrome. Easier pray. What do you mean easier pray? Okay, same pronunciation, we have different words. P-R-E-Y pray, P-R-A-Y pray. So P-R-A-Y pray, which means worshipping the God. Prarthikya ennulla meaning aanu. Here it is P-R-E-Y pray. That means easier pray, easily affected. Okay, ആരെയാണ് പെട്ടെന്ന് affect ചെയ്യുന്നത് എന്നുള്ള meaning. Affect. Okay, so easily affected. Okay, so where is it mentioned? Habits, easier pray. Again, yes, Monisha, you got the correct answer first. Yes. Okay, Monisha, very good. Which is from text B. Okay. Yeah. Second, Taku, Chinju, Amy, Shilpa, Atira. Yes, Aisha, pray, which means yes. Easily affected, like risk aanu udeshikkunnathu. Yes, Divi. Okay, Aisha, Delighta, it is from text B. And where is it mentioned in text B? See, some factors that can increase your risk include. അപ്പോൾ ആർക്കാണ് പെട്ടെന്ന് എഫക്റ്റ് ചെയ്യുക? ബീയിങ് ഓൾഡർ ദാൻ 65, ടൊബാക്കോ യൂസ് ചെയ്യുന്നവർക്ക്, സബ്സ്റ്റൻസ് അബ്യൂസ് ഡിസോർഡർ ഉള്ളവർക്ക്, ഹാവിങ് ലങ് ഡിസീസസ്. ഓക്കെ, സോ ദാറ്റ് ഇസ് ഫ്രം ബി. യെസ് ഗീത, വെരി ഗുഡ് ഡിയർ. യെസ് ജിസ, ഈസിലി ക്യാച്ച്ഡ് ഓർ എഫക്റ്റഡ്. വെരി ഗുഡ് ഡിയർ. യെസ്. Fourth one, what makes around 1 in 4 people in need of mechanical ventilation? So my keywords, 1 in 4, then need ventilation. So these are my keywords. Where they've mentioned 1 in 4 people, this ratio, 1 in 4 എന്നുള്ളത് എവിടെയാണ് മെൻഷൻ ചെയ്തേക്കുന്നത്? 1 in 4 people, mechanical ventilation, they need mechanical ventilation. Yeah. Who got the correct answer first? Yes, Divi. Very good, Divi. You are the first person. Yes, you got the correct answer, which is text A. Okay, very good. Which is from text A. Yes, Divi, Monisha, Chinju, Taku, Aisha, Amy, Delighta, Shilpa, Atira, Geeta. Okay. Geeta, it's not from text D, dear. Fourth question answer is from text A. Okay, for 1 in 4, which means 25%. Kanda. Okay, so what is 1 in 2? 1 in 2, which means 50. Okay, so here it is 1 in 4. That means 25%. Okay, that is mentioned in text A. So answer is in text A. It is the reason at least 25% people require mechanical ventilation. Okay, so answer is from text A. Yes. Okay, Ashwati and Disa, correct answers. It is from text A. Very good. Fifth one, how do we clinically evaluate the different phases of ARDS? So, clinically evaluate phases. Phases, which means different stages. Okay, stages nulla meaning aanu phases. Stage 1, stage 2. Yes. Who got the first correct answer? Yes, Monisha. Again, Monisha scored, alle? Very good, Monisha. It is from text C. Okay, yes, Monisha, Taku, Shilpa, Aisha, Divi. Very good, very good. A lot of correct answers. Yes, Amy, Jissa, text C. So my next question, where is it mentioned in text C? Okay, different phases. Where is it? Mentioned in text C. The different phases of clinical evaluation. എവിടെയാണ് clinical evaluation mention ചെയ്തേക്കുന്നത്? Which bullet point? I think it is in the second bullet point. Respiratory symptoms must have begun with 1 week clinical insult or clinical evaluation. So answer is from text C, diagnostic criteria. Okay, so answer is mentioned in C. Yes, Adira, Ashwati, Jisa, text C. Correct, no? Okay, sixth one, question number 6. Which are the different stages of ARDS? Again, different stages. Again, please don't get confused. ഇന്നലെ നമുക്ക് ഇങ്ങനെ ഒരു question ഉണ്ടായിരുന്നു. Confusing question. So here, same. Fifth question is all about different stages ആണ്, but clinical evaluation of the different stages. Next question is all about different stages of ARDS. So where is this different stages of the condition mentioned? Who got the correct answer first? Very good, Chinju. Yes, your answer is correct. Yes, Chinju comes first. Yes, Taku. Yes, Divi, Jisa. Yes, Shilpa, Monisha, Ashwati. It is from text A. Okay, different stages of the condition mentioned in text A, but the clinical evaluation mentioned in text C. That is a difference. Okay. അപ്പോൾ എവിടെയാണ് different stages കണ്ടോ? ARDS into 3 stages: exudative, proliferative, fibrotic. So answer is from text A. Seventh one. What level of pressure should be adjusted during the treatment of ARDS? So yes, how many correct answers? Yes, Aisha, Delighta, Ashwati, Monisha. Okay, correct Anu. Very good. Yes, Shilpa. Seventh one. Very good, Taku. Again, text D. Very good, Taku. It's from text D. Yes, Monisha, Chinju, Jissa. Answers are correct, which is from text D. Level, pressure, and treatment. Okay, level of pressure. Where they've mentioned about the level of pressure, the measurement, which is mentioned in text D. Kanda. Blood tube pressure, which is less than or equal to 30 centimeter H2O. So answer is from text D, the level of pressure mentioned. Okay, so any doubts? Anyone with 7 out of 7? Yes. Congrats, Divi. Yes, Monisha, 7 out of 7. So happy. Yes, Adra, it is D. Yes, dear, correct answer. Yes, Aisha, Delighta, 7 out of 7. Okay, Taku. Ashwati, yes, Chinchu. Very good. Okay, Jissa. Congrats. So now jumping to the next set of questions, 8 to 14. So what is the important instruction here? Always you guys will forget to read this. And then what is the important instruction? You can write it in a word or a short phrase. Please don't forget, okay? Word or a short phrase. That means maximum 2 to 3 words. Okay, unless it is the full form of an abbreviation. എന്താ പറയുക, ഇപ്പം അബ്രിവേഷൻ്റെ ഒക്കെ ഫുൾ ഫോം എഴുതാൻ വേണ്ടിയിട്ടാണ് ക്വസ്റ്റ്യൻ ചോദിക്കുന്നതെങ്കിൽ മേ ബി ഇൻ ദ അബ്രിവേഷൻ ഇൻ ദ ഫുൾ ഫോം മോർ ദാൻ 3 words വിൽ ബി ദെയർ. ഓക്കെ, സോ ഇൻ ദാറ്റ് പെർട്ടിക്കുലർ ഒക്കേഷൻ യു ക്യാൻ റൈറ്റ് മോർ ദാൻ 3 words. പക്ഷേ എന്നാലും മാക്സിമം ഒരു 4 words ഒക്കെ വരെ കാണത്തുള്ളൂ. സോ പ്ലീസ് ഡു റൈറ്റ് ഇൻ 2 to 3 words. ഓക്കെ, യാ. സോ 8th one. What level? Yes, Atira. Okay, Shilpa, it's okay, dear. 6 is pretty good. Okay. Yeah, so next time, 7 out of 7. Yeah. So 8th one. What level should be attained by PEEP to classify it as a moderate phase? Okay, so what is the question here? What level? Okay, so what level? Level PEEP moderate. Yeah, so these are my keywords. Yes, Shilpa. So what level? Where is it mentioned? Level PEEP, then moderate phase. Any correct answers? No answers. Adendu patti kittila? Okay. So answer is mentioned in yes. Okay, Jissa, it is less than 5 centimeter. No, greater than 5 centimeter. Okay, so I'll give you some options. Is it? Yes, okay, Jissa, can do it. Yeah. So is it greater than 5 centimeter or greater than 5 or greater than 5 centimeter H2O? What is the correct answer? First, second or third? This is correct. What level should be attained by PEEP to classify it as a moderate phase? Which one is correct? Is correct? First one or second one or the third one? Greater than 5 centimeter or greater than 5 or greater than 5 centimeter H2O? Okay, Divi, greater than 5 centimeter. Okay, any other answers? Anyone? Okay, Shilpa, 3. Where is 3 mentioned? Okay, Adira, greater than 5 centimeter. Okay. So majority you guys have mentioned greater than 5 centimeter, right? And answer is mentioned in text C, right? Alle, text C lano? Ade. Because moderate, they're asking you regarding the moderate level. So what is a moderate level? Okay, so see, answer should be 5 centimeter H2O. Okay, answer will be greater than 5 centimeter H2O because greater than 5 centimeter H2O is a single term. That's why okay, so PEEP greater than 5 centimeter H2O. That's the level. They are asking about the level. So greater than 5 centimeter H2O will be the answer. Okay, moderate. So answer will be the third one. This is the correct answer, which is greater than 5 centimeter H2O. Okay, and where is abbreviations mentioned? Yeah, I do remember abbreviations mentioned in text D. Ano? Yes. Here, ARDS, FI02, PA02. Here comes the answer. Partial pressure of arterial oxygen. Okay, so this is the correct answer, which is yes. Yeah, text C. Okay, Monisha, yes, partial pressure of arterial oxygen. Alle? Okay. Yes, Delighta, Jissa, correct answer, which is from text D, partial pressure of arterial oxygen. Yes. Okay, Aisha. That is the answer. 10th one. Okay, Atira Ashwati, correct answer. Very good, very good. 10th one. Which condition defines the severity of ARDS? So question, which condition severity? Yeah. Yes, Shilpa, partial pressure of arterial oxygen. Very good, dear. Correct answer. So which condition defines severity of the condition ARDS? That's a question. Which condition? Okay. Is it aspiration pneumonia? Severe ARDS. Severity. Yes. So where is it mentioned? Where they've mentioned about hypoxia. Okay, it's not aspiration pneumonia, it is actually hypoxia. Okay, so hypoxia, which is mentioned here in text C. See this particular bullet point. Kando. Severity of hypoxia defines severity of ARDS. Okay, so what condition is hypoxia? Yes, Jissa. Okay, I think Jissa got the correct answer. Only Jissa got the correct answer. Or, yeah, Aisha too. Okay. Okay, Aisha and Jissa, correct answers, which is hypoxia from text C. Yes, so 11th one. The preponderance of ARDS worldwide every year. So what is the prevalence? Preponderance, which means prevalence. Worldwide every year. Oru varsham ethrayanu spread cheyyunnathu. What is the prevalence of the disease condition per year? Yeah. So which is mentioned here. Everyday mention cheyidikkunne text A. Ano? Yes. Okay, so answer is ARDS affects about 2 lakh people in the United States. So it's not about United States. Adanengil you can write 2 lakhs. But question is all about worldwide every year. So answer is 3 million people every year. Okay, so what is the correct answer? Answer is 3 million. Okay, you can write 3 million, which is mentioned in text A. Yes. Okay, Atira, which is correct. Yes, Jissa, 3 million. Yes, Ashwati, 3 million. Okay. Okay, so question number 12. What might be formed in the lungs at the final phase of ARDS? That turn requires ventilation. Okay, that in turn requires ventilation. So my keywords: formed, phase, ventilation. Yeah, these are my keywords. What might be formed? Who got the correct answer? Yes. Okay, Chinju. Yes. Jissa, Chinju, Ashwati, Monisha. Yes, correct answer. Answer is scar tissue. Okay, answer is scar tissue. Yes, Adira, correct answer Anna, and which is mentioned in text A. Ano, text A. Okay, scar tissue. And where is it mentioned? Which mainly describe the formation, one of the keyword, scar tissue in your lungs and prolonged need for ventilation, another keyword. So answer is from stage mentioned on a face. So answer is scar tissue from text A. Very good. Yes. Yes, Devi, correct answer, scar tissue. And 13th one, medication used to treat ARSD. Yes, medication used. What medication is used? Which drug is used there? In the medicine are used another. Yes, Aisha, text A. Yes, this is text A, second para, almost last line. What about 13th one? The medication used to treat the condition. A, the medicine are used in there. Management is mentioned in text D. So what medicine is mentioned here in text D? To treat the condition. Yes, what medicine is used? Text D ana, very good. Yeah, text D lana. What is your answer? Answer in the A, the medicine ana. Which drug is mentioned here? Okay, very good, Jissa. Corticosteroids. Okay, answer is corticosteroids, which is the medicine we are using for this disease condition ARDS. So answer is in text D, which is corticosteroids. Okay, Shilpa. Yes, Divi. No dear, it's not prophylaxis, it is corticosteroids. Not prophylaxis, it is a procedure actually. So the medicine is corticosteroids we are using. Yeah. Then 14th one. Maximum units of blood to receive by an individual at the time of about the chances of infection. So maximum units infection. Yeah. Etra units ana? Maximum units of blood. Yes. So when you write and the answer, already units is mentioned here. Adondu repeat cheyanda avashyam undo? No. Okay, so answer is just 15. Yeah. Okay guys, don't write 15 units, okay, because already units mentioned in the question. So answer is 15. You just can write 15. Okay, 15 is the correct answer. Maximum units of blood. Yeah, answer is 15. Okay, 15 is the correct answer, which is mentioned in text B. Yes, here 15 units of blood. Don't write more than, just 15 is the answer. Maximum is 15. Okay, so answer is 15. Okay. 15 or, yeah, I agree. More than 15 is also correct. But don't write units, because units are already mentioned in the question. So either you can write 15 or you can write more than 15. Both are correct. I agree. Yes. Okay, Jissa, more than 15. Correct or not? Very good. Correct answer. Yes. Adira, it's not 15 units. They are 15. Okay, Aisha 15. Yes, Ashwati 15. Very good, very good. Okay, so now 15 to 20. Fill in the blanks. Same instructions. First one. When offering treatment, the ratio of inspiration to expiration should remain between dash. So my keywords, treatment, ratio, and expiration. Yeah. So what about question number 15? What is the missing word there or missing words there? Ratio ആണ് ചോദിക്കുന്നത്. They are asking about the ratio. So where they've mentioned about the ratio? Treatment, ratio, expiration, inspiration. So where is ratio mentioned? Yes, very good, Chinju. Your answer is correct. Which is 1:1 to 1:3. Yeah. Okay, so 1:1 to 1:3. So that is the correct answer. A very direct answer from text D here. Okay, yeah. So that is the correct answer. 1:1 or 1:3. Okay. Yes, Shilpa, Delighta, Ashwati, Aisha, Jissa, Divi. Okay. Correct answer. Then question number 16. In order to confirm ARDS, dash have to screen bilateral edema consistent with pulmonary edema. So what is the keyword here? I mean, not the keyword, what is the missing word here? In order to confirm bilateral edema, pulmonary edema. So confirm bilateral pulmonary. So what is the missing word? In order to confirm ARDS, എന്താ ചെയ്യാൻ പോകുന്നത്? So here, diagnostic confirmation. Okay, അപ്പോൾ എന്താ ചെയ്യുന്നത്? Bilateral edema consistent with pulmonary edema on CXR or CT. Okay, you have to write both CXR or CT. ഇതാണ് missing word അല്ല ചോദിച്ചേക്കുന്നത്. So you have to write CXR or CT. Both are important. Okay, so there you can write CXR or CT. That is the correct answer. CXR or CT. Yes. Okay, Jissa, Chinju. Oh, there. Correct answer. 17th one. People who have exceeded the age of dash are the ones to be categorized as the risky ones of ARDS. So, exceeded age, categorized. No, risky. Yes. Exceeding what age? One of the risk factors from text B, I remember. Yeah, being older than 65. Okay, so answer is older than 65. Correct, alle? 18th one. Healthcare providers sometimes classify ARDS into 3 stages, such as exudative, proliferative, and what? Yeah. Older than venda, you can just write 65 because more than is already mentioned there. Kando, exceeded. Okay, that means more than. Older than. So that is 65. That's enough. 65. Age of എന്നാണ് ചോദിക്കുന്നത്. So ഓഫ് കഴിഞ്ഞിട്ട് ഒരിക്കലും age of older than അങ്ങനെ പറയില്ല. It's older than or age of 65. Okay. Then 18th one. Yeah, what about 18th one? Yes, it is fibrotic. Okay, answer is mentioned here, which is fibrotic from text A, second para, third line, fibrotic. Okay, then 18th one. Dash can happen when you have a serious infection in your lungs, pneumonia, or other organs with widespread inflammation. So, serious pneumonia, inflammation. Yeah. Yes, Divi, Amy, Ashwati. Yes, Aisha, Chinju. Okay, Adira, fibrotic is the correct answer. What about question number 19? 19 the answer in the comment cheyamo. Dash can happen. What can happen? What can happen? Yes, sepsis can happen. Okay, answer is sepsis from text B. Sepsis can happen. Okay. Sepsis, yes. Okay, Jisa, you got the correct answer. Very good, dear. And the last question, ARDS, the reason at least 25% of people require dash in a hospital setting. Require what? Already we have done this question previously. So, 25% people want what? എന്തായിരുന്നു വേണ്ടത്? Yes, mechanical ventilation. So, answer is mechanical. Okay, Shilpa. Okay, dear. Yes, it is sepsis. Okay, Monisha, fibrotic. Yes, mechanical ventilation. Taku, Ashwati, Aisha, Divi, Delighta. Yes, it is mechanical ventilation. Okay, Jisa? Yes. So, yes, I'm just so curious to know about your marks. What about your marks, guys? Anyone with 20 out of 20? Anyone with 20 out of 20? Okay, Taku. 18. Okay, 18 out of 20. Anyone with 20 out of 20? Okay, Aisha, 19. Okay, Delighta, 19. Very good, very good. Okay. Okay, Divi, 18. 18. Okay. Okay. So that's that. Okay, Jissa, 19. Okay, so see you on Monday. So take care. Happy week.